Hi everyone, this is a continuation of the Hypertension Nutrition Eating Guide, and we'll talk about in Lesson 2, understanding the DASH eating plan. The DASH eating plan is an evidence-based eating plan, and it is for hypertension. It's rich in fruits, vegetables, whole grains, and it includes lean protein and low-fat dairy. It is low in saturated fat, sugar, and sodium. Why DASH works. We'll explain the benefits of the DASH program and why it works. It is high in potassium, magnesium, calcium, and fiber, and these nutrients relax the blood vessels. They are all naturally low in sodium as well. The DASH diet can lower systolic blood pressure by 8 to 14 points within weeks. The DASH diet is very important to follow, and we'll go ahead to Lesson 3 to discuss sodium awareness. So sodium awareness is something that's very important to understand because it has a direct impact on blood sugar. So as we talked about in the DASH diet, it is naturally very low in sodium and is important to incorporate. And it's because you want to avoid sodium. Because basically what happens is when you have too much sodium, when there's excess, sodium pulls water into the blood, which raises your blood pressure. Most Americans eat over 3,400 milligrams per day, so it's important to limit less than 2,300 milligrams per day for the average person. However, if you have hypertension, the goal is to have 1,500 milligrams per day or less. 70% of sodium comes from packaged and restaurant food, so it's important to really refrain from eating packaged food and eating out and to cook whole foods at home. It's important to read the food labels and understand nutrition and heart health. Check the nutrition facts panel and make sure that's 5% or less sodium, or 20% or more is high. And choose potassium-rich foods like bananas, spinach, sweet potatoes, beans, and salmon. It's important to understand how to swap foods to substitute for your health. So it's important to use fresh versus canned. So use fresh or frozen and not canned when possible. If you do need to use canned, you can rinse the whatever's inside the canned food and just rinse it as much as possible to get the salt out. Frozen is really great because it's very affordable and the vegetables are picked at peak ripeness and then frozen. Herbs versus salt are important to understand. You can use herbs, spices, garlic, lemon, and vinegar. You can flavor foods without sodium. Garlic and basil also help with the heart. It's important to make homemade meals and follow the DASH diet as much as possible. Cook at home to control sodium, manage portions and fat, and really reduce restaurant meals because one meal at a restaurant can be a day's worth of sodium.